Okay. Hello, my name is Isaiah, and today I will be talking about the 1918 influenza pandemic and what it revealed about the health systems, how poor coordination increased deaths, and the ways the pandemic changed public health for the better of the future. In the spring of 1918, a new influenza began to spread across the world. It arrived in multiple waves and spread with high speed. With an estimate of one-third of the world's population, which is 500 million people, experiencing illnesses during this pandemic, and deaths numbered somewhere between 50 and 100 million. The 1918 influenza killed more people than the First World War. The scale and the speed of the outbreak quickly overwhelmed hospitals and public health officials and exposed serious structural weaknesses. First, the pandemic exposed how weak health systems were in 1918. No, wait, the 1918. In 1918, diagnostic laboratories were limited in both equipment and understanding. The influenza virus itself would not be isolated from humans until 1933. So doctors in 1918 had to diagnose cases based on symptoms alone. That made it difficult to track the infection accurately and see a difference in the influenza from other illnesses. Hospitals were understaffed and lacked protective equipment. Nurses and other medical workers improvised masks and gowns from whatever materials were available, and many rural communities received no timely medical care at all. To make matters worse, wartime censorship and inconsistent reporting by governments and newspapers hid the true danger of the outbreak, giving people wrong information on a dangerous virus. These health risks were worse for others. Social and racial inequalities shaped how the epidemic affected different communities. African American patients in the Jim Crow South, for instance, were commonly separated in under-resourced medical facilities. In some places, black patients were treated in basement wards or makeshift clinics that lacked basic supplies. Black physicians and nurses often had to set up independent clinics with minimal resources, struggling to provide care under difficult conditions. This meant people of color were put in even harsher conditions that are already here for others. Another problem was poor coordination. Another problem was poor coordination. Cities and towns reacted differently and often at different speeds. We can see how timing mattered by comparing several US cities like Philadelphia. Philadelphia is perhaps the most frequently cited example of a delayed response. Officials allowed a large public parade to go forward, even as cases began to rise. And within days, deaths surged. The city's public health measures were slow to follow, and Philadelphia experienced a very high mortality rate. New York City responded quickly. Officials there did not wait for excuses deaths to mount before implementing non-pharmaceutical interventions, such as school closures and bans on large public gatherings. That early action lowered the mortality rate compared with cities that took late action. Pittsburgh demonstrates another lesson. It acted late and used only one measure at a time instead of several together. Being late and delayed came with higher per capita deaths. Historical research shows that cities that made multiple interventions early in combination tended to reduce peak mortality and overall deaths. The lesson from 1918 is clear: timely coordinated public health measures save lives. The 1918 pandemic helped develop a better health system. The pandemic showed governments they were not ready for pandemics at scale. So countries expanded disease surveillance systems, strengthened laboratory networks, and improved hospital organizations. Over time, more vaccination campaigns and scientific approach to infectious disease control came. In the United States, they built the Communicable Disease Center in 1946, later renamed the Centers for Disease Control and Prevention, which was because of the 1918 pandemic and that centralized public health capacity was necessary. Globally, the pandemic helped change how policymakers thought about the national responsibility for disease prevention and the value of coordinated public health infrastructure. Although improvements happened over the years instead of overnight, the pandemic had a lasting impact. Public health officials started to focus on surveillance that could detect outbreaks sooner. Laboratories improved their testing methods. Hospitals changed their design to better isolate and treat patients with infections. These adjustments contributed to a shift toward preventive medicine and more centralized public health systems in many countries. Today, the lessons from 1918 are still important. Modern pandemics need teamwork and fairness in public health responses. Quick detection, clear communication, and coordination so we can try to lower the rates of illness and death. It is important to make sure that everyone can access care and resources, that people of inequalities do not have worse effects from that outbreak. In short, the 1918 influenza pandemic taught three lessons. First, weak health systems, with limited lab staffing supplies, are almost useless to deadly outbreaks. Second, there's a matter of coordination. Delayed or uncoordinated responses cost lives. And third, this pandemic drove a change, leading to investments in laboratories, hospital infrastructures, and public health institutions that strengthen long-term healthcare. Those are the main points. As we think about the future public health threats, it is important to remember that investment in public health is not only a technical matter of laboratories and hospitals, it is also social commitment to equality and to the political will to act early and together. The 1918 pandemic remains powerful, reminding that world-altering disease events are preventable, or at least might mitigate, or at least when systems are prepared, responses are coordinated, and care is distributed fairly.